Can we use the right hand so that all the cameras can get the shot?
Turn a bit there. Yeah.
So the Guyanese Critic is coming to you from the Georgetown Public Hospital for daybreak news, where the first ever COVID-19 vaccine in Guyana has been administered on a pharmacist. This was witnessed by ministers and officials of the ministry. So, yeah, man, clear the way, man. So the minister is going to, some extent, explain to us what the process has been, and I'm hoping to speak to the persons who had the first vaccines administered to them, to get a feel of what to expect. So they have the CEO, the deputy CEO of the Georgetown Public Hospital on the ground here, and some other senior officials and doctors here. And what you just witnessed is the first ever COVID-19 vaccine being administered to a pharmacist. The young lady is a pharmacist, and I think the next person is a doctor who, two persons this morning signed up for such vaccine.
Okay, Minister's just going to make some brief remarks. Okay, so we'll have some brief remarks from Dr. Hamilton, Dr. Jeffrey, and Minister, and then we'll open up for a few questions before they go over to Ocean View.
Minister, just come forward a few steps. In the center.
Dr. Hamilton will go first.
Good morning, everyone, and thank you for all being here. Today marks the first COVID-19 vaccine that was administered to one of our healthcare workers. As you have been hearing over the past few months, Guyana has embarked on ensuring that there were vaccines available for all of the persons within Guyana so that we can find a way to be able to contain this disease. The expanded program of immunization is the team at the Ministry of Public Health that will be responsible for ensuring that everyone who's eligible receives a vaccine. According to our national vaccine deployment plan, our priority groups would be healthcare workers, our joint forces and other frontline workers, our elderly, and persons with comorbidities. In our first wave, which will be looking at the small group of vaccines that will be available to us, we have embarked on ensuring that the healthcare workers who are more at risk receive their vaccines. And so the group of persons who will receive vaccines over the next few days are those persons who are in direct contact with patients who have COVID-19 or patients who are suspected to have COVID-19. And as our vaccines come in, we will continue our deployment according to our plan. Minister will continue the conversation on what are all the other plans. But just to note that our end game in all of this is to ensure that we have herd immunity, and herd immunity requires at least 80% of our population to be vaccinated. So we're asking you to join us in ensuring that everyone has the right information and they're ready to take their vaccines. Thank you.
Good morning, everyone, Minister, CEO, members of the press, colleagues, all. It's a pleasure to be standing here today and witnessing the first member of my staff getting the vaccination. As you all know, the Georgian Public Hospital has been in the forefront in the managing of COVID patients since its inception. And my staff has been brave and courageous, working with these COVID patients even though the uncertainty and the fear existed. We have rallied out since March 2020, and when we look at all the work that is done, all the burnout that might have happened with our staff, we are really happy to know that today we can give them what is necessary, and that is the vaccination. So it will give them the kind of protection so they can continue the job that they have been doing to assist us in our fight against the pandemic. So I would like to thank all the staff, thank the Minister of Health and his personnel that would have provided this opportunity for us to get the vaccine. And we will continue in our fight against COVID until we are the victors. Thank you.
Good morning, everybody.
Good morning.
First of all, let me thank you all for coming. I think we have just witnessed a very historic moment where the first COVID-19 vaccine was administered to one of the staff here at GPAC. This might look like a very simple moment, but it marks, I would say, the beginning of the turnaround of this pandemic in Guyana. Because our intention is to ensure that we reach herd immunity, which means that over the next couple of months that we would be able to secure enough vaccines. So most of the adult population here in Guyana would be able to get those vaccines. We are extremely pleased that to initiate this process, the government of Barbados, through Prime Minister Neil Motley, has sent this first set of vaccines to us. But later in the month, we will also be receiving other vaccines that we have been working on. So we would be able to get enough vaccines to cater for our population. And I'm sure as we administer more and more vaccines, that we will be able to bring this pandemic under control. Our reason why we are starting here at GPHC, as Dr. Jeffrey would have explained, is that GPHC has been the epicenter of this fight. They have been the ones where the most severe patients have been coming here, and they have been interacting with these patients, so the staff here is more at risk for contracting COVID-19. About 2 months ago, we have been able to separate out patients from the Georgetown Hospital, and we now house most of those patients over the Ocean View facility. And therefore, because of that, we've been able to return some sense of normalcy to this hospital. But nevertheless, because of the volume of patients that have come here, we have to still screen to see who are positive and who are not. And therefore, we thought it fit that the staff here should be the first ones that we start with, but very shortly we will be rolling out this process to other regional hospitals as well. So, you know, it's a start, and I'm sure in the next couple of weeks as we ramp up this process, more and more people will become vaccinated. As Dr. Hamilton emphasized, we would really need a lot of public education to ensure that people understand how vaccines work, how they can protect you, and also to dispel some of the negativity that surrounds vaccines, because there are persons who are totally against vaccines, and you know that's not going to be helpful in this fight against the pandemic. Around the world, this is a very scarce commodity, and therefore once we're getting it, we want to ensure that we can get it into the arms of people as quickly as possible. So once again, I think we have just witnessed this historic moment that would mark the beginning of the end of the pandemic.
Minister, how many healthcare workers across the country are we looking at in both the public and the private sector? And let me just ask all of my questions at the same time. And will government be looking to ensure the vaccination of the private sector workers as well? And are we open to using this AstraZeneca vaccine because it is more easily stored than the Pfizer or Moderna vaccines?
So we are starting today, but by the end of the month and going into March, our hope is that every single health worker would be able to get vaccinated. So we will have by then enough doses of vaccines to be able to provide to every single health worker, whether you're in the public sector or in the private sector. So we have worked out a deployment plan, how we're going to roll out vaccines, and the first set of people is the healthcare workers. After that, we'll go to persons who are older, because again, based on the risk profile, we have seen that older persons would get the more severe form of the disease, and we want to protect them. And that's why we are going to be rolling out to older persons. And then we are also looking at all those persons with comorbidities who have some underlying illness like diabetes or hypertension or cardiovascular diseases and so forth. And those persons also, we would offer them the opportunity of getting the vaccine. In terms of the types of vaccines that we'll be using, we have made arrangements with COVAX, where we will be getting the AstraZeneca vaccine from COVAX, and we have some bilateral arrangements where we would also be getting some more of the AstraZeneca vaccine. We have also, in March, we are going to receive a donation of a Sinopharm vaccine, and that too we will get 20,000 doses of those, which is very highly effective. And we are making arrangements to also get the Sputnik V vaccine, and that too will become available to use when we roll out this process.
Could you speak to the number of healthcare workers that we're looking at?
We have estimated that the amount of healthcare workers will be around 22,000, I think. So we will have enough vaccines to cover everyone. And as you know, these vaccines are 2 doses. With the AstraZeneca vaccine, after the first dose, the most recent information from WHO is that within 8 to 12 weeks you give the second dose. So we would be administering that second dose. And the reason for that extended period is because after the first dose, you need to have enough time so that the person's immunity can be built up to a high level, and then you do the second dose.
Minister, you noted that you conducted sort of a hesitancy survey. Could you give us an overview of that and perhaps how you intend on navigating the challenges of healthcare workers who are hesitant about receiving the vaccines?
Yeah, we did do that hesitancy survey between the Ministry of Health and UNICEF. And we have identified certain groups of or segments of the population might be a little bit hesitant in taking the vaccine. And we have explored with those groups maybe some doing some focus group sessions to understand what are the factors driving that hesitancy. And based on that information, we have now developed a risk communication strategy that we are rolling out, some of it specifically targeting some of these segments so that they can better understand the information. And we strongly believe that once they have that awareness, then it would alleviate some of the fears and concerns that they have.
What
so
are
we're
those
working
groups?
on that.
Could you say what
There are different groups. I can't remember them all offhand, but as I said, we can make the survey available to you.
Minister, can you say if a team from the Georgian Public Hospital will be monitoring the side effects, possible side effects of these persons who are vaccinated?
Yes, they will, but we also have a national group that has been established to do the monitoring for any possible side effects. As you know, those side effects are largely two types. The first set is what is called reactogenic side effects, meaning that at the site of the injection, you can get a little bit of redness, a little bit of pain. These are not really worrisome because after a few hours to a day or so, they go away. And with most vaccines, you will find that type of side effects. So we are monitoring for that, and if to report them, we will be able to help them. But even before they receive the vaccine, as you notice, when the first person was getting their vaccine, the nurse was explaining to them what are the possible side effects to expect and what to do in case they get these side effects. So I think that is well managed. And then you have a second set of side effects that we look for, which are called adverse effects. And generally, any major reports or any adverse side effects in the international literature, and you know millions of doses have been administered, and we have been monitoring to see whether or not there have been any reports. So we haven't seen any reports of adverse side effects from the AstraZeneca vaccine, and but nevertheless, we have a committee that is constantly going to monitor to make sure that we look at the reports on a weekly basis as we start with this process.
Now that the vaccination drive has started, when will the ministry commence their education campaign, public education campaign?
That has started actually in some ways because we have been talking about the vaccine for more than a week now, and one of the features that has been done by DPI, they have been taking specific questions relating to vaccines, and we have been answering those questions in a bit to get people to understand more about how these vaccines work. But we will, of course, increase the tempo now that vaccines are here so that we can disseminate the information more widely. And therefore, we really would hope that you can all assist us. And if you require any information pertaining to vaccines, we can make that information available. The technical staff in the ministry, Dr. Hamilton and others, they have lots of technical information that they can share with you. And we are hoping to do some generic videos and ads that can be used to educate people.
Final question. There were some data with regards to the dosage for the vaccine. I think it was 1.5 doses. You will have a different efficacy level.
Right. So with the AstraZeneca vaccine, when they did the clinical trial, the phase 3 trials, there was one particular trial that was done in the UK where they had a subset of patients that were given half a dose and then a full dose as the second dose. And when that happened, they found that the efficacy of the vaccine was 90%. So they are going through some studies to see how this worked, and they're going to make some recommendations based on additional studies that are being done. But one of the things, because when they did the clinical trials, they did it in 4 countries, and they look at the efficacy in all of these countries, and look at different parameters. So if you space the dose for more than 3 weeks, 4 weeks, what would be the effects and so forth. So you get the same dose of the vaccine, but when you lengthen the time, the effect is much better. And so one of the recommendations that came out of SAGE 2 days ago is that instead of giving the second dose on the 4th week, that you lengthen that to about the 12th, between the 8th to the 12th week. And when you administer it in that way, we see a higher level of efficacy. So we will be following the latest guidelines that are coming out of the WHO to ensure that we get more efficacious results.